Hi, I'm Katie Dietz, Marketing Coordinator with Nurses PRN. Today we're at Insight Eye Care in Oshkosh talking to Dr. Ryan Ames about macular degeneration. He will be discussing what it is, the causes, symptoms, prevention, and treatment. Please take a listen and enjoy.
Well, macular degeneration is a degenerative condition of the retina. Your retina has rods and cones in it, like you learned in first grade. And the center of the retina is called the macula, and that's the high definition part of your eye. And unfortunately, macular degeneration affects that smack dab center of the retina. And so it's the part that you use to read with, you look at faces with, all this fine detail stuff. And it's basically a rusting of the retinal tissue. And it slowly breaks down over time, sometimes just a little bit, sometimes very advanced, and you can't really tell which way it's going to go. But it's a degenerative condition of your retinal tissue. It's mostly genetic.
Okay.
The genetic component of it is the most likely cause. The only risk factors that you can affect are by smoking or UV and blue light exposure. We used to think it was always UV light, and now there's a lot of studies coming out showing short wavelength blue light, which is induced by LED lighting, our cell phones, flat screen TVs. All the newest technology has a short wavelength blue light that penetrates deep into the retinal tissue and is very oxidative. It's a very slow process. So in the early stages of macular degeneration, people don't know they have it. Most of the time, their initial diagnosis is they come in for a regular exam and we find signs and symptoms of it, mostly signs early on. So we'll look in the retina, instead of having normal pigmentation, we'll start to see discoloration of that. And that's a sign of the tissue starting to break down. There's other signs where there's drusen in the retina, which is a buildup of cellular debris that's not being taken away properly. And early on, when we see those, people aren't usually symptomatic. They still can see very, very well. But as time goes on, as the tissue progresses, as the disease progresses, they'll start to notice their vision not as clear as it was. It starts to lose clarity in that very center part. That's the really crummy part about it, is it affects the very central retina, which is the part you need. And the peripheral tissue isn't affected. So it's that fine detail vision in the middle that they start to lose. There's not a real good way to prevent macular degeneration. I usually tell people you pulled the short straw. It just happens. Once someone has macular degeneration, taking eye vitamins over the counter, there's a bunch of them, and it's called the ARID study that came out with the research that showed that certain vitamins, lutein, zeaxanthin, mesozeaxanthin, zinc, those type of things are antioxidants, and they help slow the process. So once someone has the disease, the studies show that it's up to 24% reduction in the progression if you take these supplements. But early detection is always useful. If it starts to progress there's two different forms of macular degeneration. There's dry, which it starts with, and then as time goes on, it can progress to wet. And wet is when new blood vessels start to grow. Blood is wet, that's why we call it wet macular degeneration or exudative macular degeneration. And these blood vessels grow within the retinal tissue. They grow like weeds, so they grow where they're not supposed to. They're very leaky, so they destroy the tissue, disrupt it, and cause swelling, which causes the vision to get worse much more quickly than the dry. The good news is we do have treatments for that. If someone has dry, it's take these vitamins and let's hope it doesn't progress. If they have wet, then we set them up with a retina specialist, and then they can treat them with medications called anti-VEGF medications, which is anti-vasoendothelial growth factor. And what happens is as the tissue dies off, it starts to release this vasoendothelial growth factor, the signal to tell the other blood vessels that the tissue's sick and it needs nutrients. So these other blood vessels start to grow and cause damage. So what we do is do an injection to block that signal. So then that tells the blood vessels, hey, we don't need you because we don't want them. And then we can try to convert it back to dry.
Your eyesight is precious, so be sure to schedule regular eye exams to ensure the health of your eyes. Thanks for watching this month's video blog. We'll see you next month.